Here we are. Okay, I will get started. Hi, everyone. Welcome to the town hall here on August 20th, 2025. Really excited for tonight's conversation. Melody and I are going to kind of tag team in a conversational chat about really research participation. This is kind of our second series on clinical research. We had another one back in July about just basics in terms of clinical research, but tonight we're really going to talk about research participation, your rights, responsibilities, and informed consent.
Fantastic.
Next slide, please. To go through the agenda a little bit, Melody and I are going to walk you through our SCN2A website. It was recently revamped, whoop whoop, and we'll show you some resources and links to how you can find those relating to the conversation tonight. Secondly, we'll really go into how do you decide to participate in research and important questions and things to consider when having these conversations with your family. And then research study participant rights and responsibilities. We're going to talk about the rights and responsibilities to their core. And then lastly, touch on giving informed consent or assent, including benefits and risks of participating in research, clinical research, whether it be interventional or even observational. Next slide, please.
Oh, great. And hi, everybody. My name is Melody Kaiser. I'm so excited to join you here today. My background is in bioethics and patient advocacy. And I also had the distinct pleasure of helping the SCN2A team get this new website up. So I wanted to highlight some of the new tabs on the website. So if you go to scn2a.org, you can either click on the research tab or do /research. And we have a whole bunch of topics to cover on the site, including how to participate in research, the research roadmap and treatment pipeline, which we're going to talk about a couple of times. I keep referencing back to Morgan. We have clinical trials and research opportunities. Those are the trials that are actually, or the research projects that are actually recruiting or have recruited and have some results now. We talk about research funding a little bit. Patient-centered drug development, that's making sure that the patient voice is ever present in, for manufacturers, drug developers, and for regulators like the FDA. There's a little bit about our research network, all the amazing global folks who are working really hard to work on treatments and hopefully cures, and then also key publications. So those are some really essential documents that either families or clinicians or providers like your teachers or your occupational therapists or anybody who wants to learn more about SCN2A related disorders can go to the key publications page. You can also scan this QR code as well. For tonight, we're actually going to focus on the tab called How to Participate in Research. And even within that tab, you can see we have a whole bunch of different topics. So for today, we're really talking about how to decide to participate and rights, responsibilities, and informed consent. In previous town halls, we've talked about types of research and clinical trial basics, and in the future, we'll cover some other topics such as getting research ready and how to protect your identity and some frequently asked questions. But for now, we're going to talk about how to participate in research. Um, and starting off the conversation, Morgan and I want to talk about how to decide to participate in research. Deciding to participate is a very personal decision, especially if it's an experimental treatment or a clinical trial that potentially has more risk than an observational trial. And it's especially complicated when we're asked to make decisions for other people, whether it be children or adults who cannot consent for themselves. And so we're making choices for others, and that makes it even more complicated. And just wanted to really highlight that every family, every person has their own goals, their own desires, and their own individual risk tolerance for interventions or experimental treatments. And those risk tolerances may differ from people on your medical team. So your provider may be, really positive about an experimental treatment, or they might be really hesitant because they don't have as much information, and your personal tolerance may be different. And then even within the same family, people may not share the same views, which gets complicated if you're co-parenting or sharing responsibility, because it's a tough decision to make. And so Morgan and I, as we were preparing for this slide, we were talking about our own personal risk tolerance, and I tend to be pretty risk averse. I don't take a lot of chances. I don't typically want to participate. I don't want to be the one who's trying a new treatment. I don't even honestly like phase 4 treatments, as Morgan had shared in the clinical trial basics. Even after a drug is FDA approved, there's phase 4 where they're collecting additional information about more side effects. And I'm usually like, I'm okay. I'll wait to see. I'll let some other people try that before I try it. I'm good. Um, but that's the luxury I have of being a person who hasn't had to make tough choices about about trying a treatment. Sometimes you don't have the luxury. Sometimes that experimental treatment is the only option, in which case your risk tolerance shifts pretty significantly. So, Morgan, how about you? What have you thought about for
Yeah.
your risk tolerance?
Well, I would say I would classify myself as someone who likes to really look at a decision methodically. I like to list pros and cons. Sometimes I write it out on a piece of paper because that just helps my brain organize. Like, if I make this decision, what are the benefits? And if I make that decision, are there any non-benefits? Are there any risks for myself? I would say I'm risk aversive if it comes to something really personal that could be catastrophic or life-changing. As with Melody, I have the luxury of not having been involved in making those decisions myself yet in life. Um, but yeah, as I said, there's no right or wrong way on how you decide to make a decision. What your risk tolerance is your risk tolerance, and it's just really important to stick to what you believe and what your processes are.
Thanks. Anybody from the audience want to chime in a little bit about maybe some choices that you've had to make, or what your risk tolerance or how you process information, like whether you should try something or not try something? If anybody'd like to join in.
So I have to make a comment because we're talking risk tolerance, and I'm a financial guy, so I'm in love with the conversation.
Yay!
Um, this is great. Yeah, what's interesting to me, and I was talking to one of the researchers at the conference, and so I think that the weird part is like your risk tolerance can even really change depending on, my son has gone
Totally.
through some really tough times, and so like during the bad times, all of a sudden you feel like, boy, my risk tolerance feels a lot higher because like, we feel almost desperate. And then other times like, oh, things are kind of smooth right now. And so I've often kind of wondered, I wonder if you're the tendency is when folks are in the bad stretches, maybe they're more inclined to like
Yeah.
take that chance because they're
Mhm.
they're desperate, right?
100%, and I love that you brought that up. And also on the same note, sometimes people have, or we've observed that sometimes people are more willing to take big risks if they have a child that's losing skills versus a child that has never gained
Totally,
those skills. It feels more
totally.
urgent or it feels more unstable, and
Yes,
people will take a bigger risk to try to stop that and stabilize it. No, you're absolutely right, and I think what you're catching me a couple slides early, but one of the things that we consider is not just the risk of the intervention or the trial or the whatever that you are considering doing, but also what's the risk of not doing it? What is the
sure.
risk of allowing the natural history or the projected course? Sorry for my dogs. But what is the risk of
You're good.
letting it play out without intervening? And so that can be a real consideration.
Sure.
Definitely. Sean, would you like to add something?
Maybe just a quick one, just because Dan's there, and I know he'll jive on this. But in finance, I think conceptually we as humans think of risk as always like negative risk quantifying. But in finance, we actually think about risk as like positive and negative risk. And I think when we think about therapeutics, there are some drugs that have higher upside risk than others. And I
100%.
think when you kind of put all of like the positive and negative risks into a spectrum, it helps you kind of frame that decision in a different light.
I love that you guys are bringing this perspective because I think a lot of times we don't consider that positive risk or the big risk, big reward kind of thing that comes with finance or people taking chances with stocks or taking chances with, investments. Like that's a really great way to frame it. And I think it also just really helps in any future conversations I have, I may ask the person I'm talking to, like, what's your background? And say, oh, finance. Okay, now I know what to, how to address that because it does frame how you look at the world, and I think those are great examples. Thank you both. Anybody else from the audience want to jump in on this? We'll have time at the end as well if we want to continue the conversation. I just want to make sure everybody's voice is heard. Okay, great. Well, we'll just move on for now. Um, So when we're also talking about research, there's rights and responsibilities. And the rights are of a research participant are very well documented, more than we could possibly include in here, and are deeply embedded in the research um, community. Everybody understands that there are, many protections for research participants. Some highlights, you have the right to be treated with respect and dignity. You have the right to ask questions and give informed consent in a language that you understand. So if English is not your first language and you are eligible to participate in the study, then you have the right to have those informed consent conversations in a language that you understand and to sign forms in a language you understand. You have the right to privacy and confidentiality. The next one's a really critical one. You have the right to decline to participate in research, always. And you also have the right to say yes and then change your mind. You can withdraw from research protocols. Um, there's also extra protections for children and vulnerable populations, which would include adults that cannot give consent themselves or don't have full capacity to communicate or make decisions for themselves. But in addition to the rights, you also have some responsibilities if you're choosing to participate in research. And these are critical not only for your own safety, but also for the integrity of the research project. The goal of the research project, especially if it's an experimental treatment, would be to get an approved treatment. And so if the participants aren't fully honest or follow the research protocol instructions, that can harm the integrity of the research project and make it so that we don't get the results that we need to really evaluate whether or not the treatment is effective. So some examples, please be honest, don't lie or exaggerate to fake eligibility for the study. When the study has eligibility criteria, it's set for a reason. And so sometimes people will wiggle because they really want to get in on the clinical trial. And it's so understandable. Like you do anything for your kid or you do anything to have a chance, but that those protocols were set for a reason. And so if you do something that gets you into the trial, but you really weren't eligible, it can really harm how that works. So Morgan, do you want to jump in
Yeah,
a little bit
so an
more on that?
example would be if you had decided that you wanted to participate in an interventional trial, there's a set of inclusion criteria that you will have to adhere to and qualify for essentially to be deemed eligible. So an example could be the amount of anti-seizure medicines that your child is currently taking. So to really be honest about that particular number is very, very important so that down the line there couldn't be any issues with data confidentiality or data procurement, essentially, especially given if the drugs are different mechanisms of action or yada yada. But that would be an example of a piece of information that is essential to be honest about.
Sounds great. And then also to another responsibility is to follow the research instructions. So if you enroll in a trial and they say, every Monday morning you need to take this medication and you forget or you didn't get around. For some reason, Monday came and you did not take that medication. Just be honest with the team. Let them know that you took it off cycle. That way they know how to evaluate it. Or honestly, if you sign up for the trial because it sounds so amazing, and then you realize you're like, wait a minute, once a month I'm supposed to go, to Cleveland. I don't want to go to Cleveland once a
Right.
month. How about if I skip that? And you're like, well, that's really kind of part of the protocol. So we really need to say like, I'm sorry, I did enroll in this. I realistically cannot come to you once a month. Can is there anything I can do locally or, do I have to disenroll from the trial?
Mhm.
Um, Another one that's really critical is to share complete information about side effects or symptoms. So for example, actually, Morgan, you want to give the examples? I don't like.
Yeah, yeah. So this really has to do with once you've enrolled in the trial and your child is receiving either active drug or placebo, depending on the design of the trial, you have to keep in constant communication with the study context and notify that provider of any symptoms or side effects, whether it be nausea, increased seizures, basically anything. And even if you think it might be related to the drug that your trial is on, whether it be active or placebo, again, you probably won't know what that is going to be. You have to let them know if you see any symptoms or side effects. A crazy example I've seen in some real world data is that an arthropod bite, like a bug bite, was listed as a symptom or side effect when a participant was in a clinical trial. And this is something that, I mean, it could be related to the anti-seizure medicine and investigation, or it could not be, but that is something that the clinician would have to know, even if it's a bug bite or a broken bone, something that you as the parent might think is or is not related. They still need to know any side effects or symptoms that your child could be experiencing.
Perfect. Sounds good. And then the other next one is, to make sure that you're informing your clinical doctors, the doctors who are taking care of you as your medical providers, and your pharmacists of any protocols that you're in. So especially if it's an experimental treatment, just so that they know if they have to make any other adjustments. You may not know if you're getting the experimental treatment or a placebo, depending on the clinical trial, but you should still make sure that they understand that you're part of that trial because it could potentially change medications or the care plan if they think that you even might be on one of those. So really important. Morgan, did you have anything you wanted to add to that one?
Um, no, I think you
No,
covered
okay.
it.
Sounds good. And then this one's a really important one. If you do participate in a trial, it's really important to keep your study information private, especially on social media or in support groups or, at conferences or when you're talking to other families that potentially could um, be in some of these trials. And it's just really important to make sure that your experience isn't biasing other people who might also be in the trial, and they may it could potentially influence results if people think that they know, like, oh, this kid was in the trial and they had
Mhm.
side effects, and so now my kid's in the trial and they're having the same side effects, so they must both be on the active drug, and they start sharing information,
Mhm.
and it gets a little bit complicated. So just making sure you keep all of that information private while you're in the study, and for the period of time that the study is still ongoing.
Mhm.
Morgan, did you have anything you wanted to add?
Yeah, I just wanted to add, while you are with your family and your child while participating, like we said, you might notice particular changes that the child undergoes, whether it be a decrease in seizures or an exacerbation of seizures, for just an example. And it's really important to keep that information confidential to yourself, because if we were to post that or mention those kinds of things in conversations with other families while you are participating, that could then bias the results of the trial and then the participation of those families going forward. So, even if it is something really great and you really want to share and you're really excited because it's providing a sense of hope, it's important just to maintain confidentiality so that that trial can run its course and lead to a benefit of the hopefully the drug getting approved down the line for many, many more families that could have the same effect that you might be noticing.
Sounds great. Now, on the flip side, if you're talking about something like the natural history study, share away. Say, hey guys, I signed up for the dragonfly study and it's amazing and I'm helping research and it's not that hard and this is going to help our kids, and hey, you should do it too. Like,
Mhm.
post away. Absolutely. It's more for for biasing clinical trials that we're
Exactly.
worried
The
about.
interventional studies
Yeah,
directly. And even if you did clinical picture maker, like that's awesome. I took this really awesome video of my son. Please, please, all the more with the many videos we can get. That's the best.
absolutely. Oh, fantastic. Okay. Anybody from the audience want to jump in for anything about rights or responsibilities or any questions before we move on? All right. I shall move on. My favorite slide. Okay.
Mhm.
Um, this is so important to me. I told you I'm a bioethicist. Informed consent is my thing. But what I really want to emphasize, if you remember nothing about this presentation, informed consent is not just a document that you sign. Informed consent is a process. It's a process of communicating. It is conversation. It's making sure that you have all of the key information that you need and that the study team is addressing all of your questions and concerns. And the reason I chose this picture, besides that I really like this lady's purple dress, the clinician or I'm sorry, excuse me, the researcher or the research coordinator, whoever is talking to this family about their informed consent process, like the questions, if you notice she's not wearing a lab coat, and I think that's really important distinction. She may be a doctor. She may be that child's doctor. But in the role of research, she is a researcher and she is sticking to the protocol, and she is sharing information in a unbiased and scientific way that hopefully is considered separate from her role as a clinician. And it's a really hard distinction for some clinicians and clinician researchers to make, but it's really important to understand that in the context of a research protocol, the role is different. And so this person is maybe also the clinician, but took off her lab coat and is having that conversation. So informed consent. I did want to just briefly mention, I could talk for an hour about this topic, but I just wanted to briefly mention two words that you may hear in pediatric clinical trials or pediatric research, which is consent and assent. Consent is a legal authorization to participate. So as an adult, you can consent for yourself to participate, or you can consent on behalf of somebody else that you are authorized to consent for, whether that be a child or an adult who cannot make legal decisions and you have guardianship or healthcare power of attorney or some ability where you get to make decisions for them. Assent is the person's the child or the adult without the ability to consent, it's still their permission to participate based on their level of understanding. It's so, very different between a baby and a 16-year-old for how much they can understand what's happening and how much they can volunteer their thoughts. The opposite of assent is dissent. So if you picture like dissent, like you're like, no, I don't want that. Assent is yes, I'm saying it's okay, or I'm saying it's not okay, if that makes sense. Again, we could talk about this for an hour. I'm gonna jump over it unless somebody has any questions about this. But we can talk about it more at the end if you want to dig in deeper. Okay. Um, Before we have your informed consent conversation, the most important thing is to think about what your goals are. What are the goals of your participation in this clinical trial or in any research project? Examples of some goals might be that you just want to contribute to science. You know that it takes everybody participating and sharing to get to the finish line, and so maybe that's your goal, or just generally improve knowledge about the condition. So if you're, volunteering blood work or you're enrolling in again, natural history study or something like that, where you're trying to help the scientists and researchers understand more about your condition. Is that your goal? Are you enrolling in a clinical trial where you're hoping for some symptom management, like, seizure control? Are you hoping to slow or stop the disease progression? Regain lost function, or are you hoping for a cure? I'm going to punt this over to Morgan to give some examples within the clinical trial pipeline
Yeah.
right now, the research pipeline, of how some of the current um,
Mhm.
studies might fit in with some of these goals.
Definitely. So, as Melody mentioned, you can navigate current clinical research opportunities on our website. Happy to walk you through that at the end if you need more direction. But an example is our patient registry, Dragonfly. This is something that you can consent to be involved in. It's a natural history patient registry that allows us to improve general knowledge about the condition. So, that's a specific example. Symptom management would be all the interventional clinical trials that we have listed on the website for either autism spectrum disorder symptoms, whether with mood, irritability, seizure control symptoms as well. There are a list again of all of these different interventional clinical trials on the website. And I'm actually working on creating a framework for finding additional clinical trials that relate to other symptomologies for our community other than just seizure count or autism spectrum disorder. So stay tuned for some more information on that. Slower stopping disease progression. This is really hitting on the antisense oligonucleotide trials that are out there, particularly giving an intrathecal injection of an ASO. These are also listed on the website, all which fall within the interventional clinical trial category. To regain lost function or to find a cure. We might not really know if all of these interventional trials that are currently available could regain lost function for our children or potentially lead to a cure, but they could. And so this is just another goal that you could consider. And I think everyone has their own definition of what cure really means. But like we said, we've got current opportunities posted on the website, and these are just things that you can learn more and delve into if they really align with the goals for your family.
Thanks so much, Morgan. And I really wanted to point out that you may have personal goals. The clinical trial has goals of what they're hoping will happen with the intervention, and sometimes those goals don't line up. So it's really important as part of your informed consent conversation with the research team to make sure that you're in alignment. If the goals of the trial or the research study are to gather information and you're hoping you're participating in something that's going to help your child regain lost function, that might not be a good match. If it's something where you're hoping for some degree of symptom management and they're hoping for a different degree of symptom management, but it's possible that they'll line up. That might be a better chance. So, for example, seizure control. You may be hoping to enroll in something where seizures stop. And maybe the goal of this trial is to reduce seizures. And, is it likely to line up? You're closer, maybe that's enough. It's worth the conversation, just to make sure that everybody's in sync and has the same expectations. And then going back quick for 1 second, the goals of the clinical trial or research study, that's something you can ask the research coordinator or whoever is giving you the informed consent conversation and sharing the documents with you. They'll give you a better sense of what's a realistic goal for that study. And then when Morgan was talking about her risk tolerance, saying you're very analytical and you like to list the pros and cons, this is my favorite way of evaluating some of these risks and benefits. And you can do this for clinical trials. You can do this for, just general medical care. You can do this for lots of different things, even outside of medicine. It's just a way of assessing risk tolerance. And maybe you could even do it in finance. I'll have to check back with Dan and Sean to see if this fits with what you might counsel somebody on with their investments. But I like to remember BRAIN. So B is benefits, R is risks, A is alternatives, I is intuition, and N is numbers. And I'll show you, N sometimes changes, so we'll get to that in a second. So benefits. What good or positive outcome might there be for participating in this research? Sometimes there's a potential for a direct benefit to the participant, and sometimes like early access to experimental treatment. Sometimes the benefit is just that you're contributing to general scientific knowledge, which could help with future treatment discovery, or future treatment approval. And sometimes it just feels good to help. You may not expect any direct benefit from the study, but you still feel good that you participated, and that's a benefit. Um, Morgan had listed some benefits here. Do you want to go ahead and share
Yeah,
some of
yeah.
these?
So some other benefits include the potential for a therapeutic effect. So if you decide you want to enroll your child in an interventional clinical trial that really hits on a symptom that you want to try and find improvement on, having your child be enrolled in that trial might cause the potential for a therapeutic effect. As we mentioned in the previous town hall in, what month is it? July.
Yeah.
You might not always know if your child will be receiving active drug. They might be receiving placebo, but you will not know whether that you won't have that distinction labeled out for you. So the potential for therapeutic effect is there. Next, just as Melody had mentioned, you could contribute to scientific research or to finding a cure down the line. Participating in an interventional trial, whether it's phase 2 or phase 3, is contributing to scientific research and potentially could lead to a cure. We don't know whether that could be a cure in 5 years, 10 years, or what now, but participating in that trial will help advance science. I'd also like to mention I lost my train of thought, so I'll come back to that. But then the third thing, there are things called an expanded access program or an open label extension that are part of an interventional clinical trial that typically an open label extension comes after the trial has been completed, either phase 2 or phase 3. And this is the opportunity where if you're participating in that trial or your child is, they will have the opportunity to obtain and receive active drugs. So they will be actually, you will know at this point in the trial, because it's the open label extension, your child is receiving active drug. Um, and so those are just some examples of benefits. Yeah.
Fantastic. Anybody from the audience want to share some other benefits that you either are hoping for or that you've experienced, or that you could think of might be something that you'd like to share? Sean?
Melody, how do you think about benefits to the family outside of our kiddo? And how is it good to kind of incorporate those within your risk logic?
Well, that's a great question. I think about benefits and risks. Like, I don't think any human exists in a vacuum, right? Like, they're all part of the
Yeah.
family unit. And so, for both the benefits and the risks, I mean, gosh, that's a great question.
I guess even thinking like in our community, like sleep is so challenging, you know.
Yeah,
And
that's a
if it's
great
something that like
example.
helped
Oh
our
my
kid
gosh,
on sleep, helps the whole family in sleep, and then your work improves and
that's a
Yeah.
family
brilliant
dynamics improve.
example.
A big factor to consider. Yeah,
Yeah,
definitely.
that's huge. That's huge.
And important to bring up in those conversations during the informed consent process for sure.
Yeah. And it gets a little bit dicey in in ethical research to, consider the needs of others when you are trying to make a decision for that one person. Like sometimes in the academic ivory towers, we want to be very like, but only this person counts, right? And they exist in a family unit. And so if let me give an example of a clinical trial that I had heard about. And it was considered a failed trial because it didn't meet its endpoint, meaning that like they were hoping that it was going to do one thing and it didn't do that one thing. But the one thing that it did do was it stopped the children, several of the children who are participating, it stopped them from frequent vomiting, which meant that they and their family could go out. That is life-changing, right? It wasn't the endpoint that the drug developers were looking for, but my goodness, did that have a positive impact. And so,
Sign me up
as a
for that one right now, Melody. I'm in. I'm in on that drug. Where is it at? I need
right,
some.
seriously, Dan,
I
right? Like
need
that
some
is so
margaritas.
huge. It's so huge. And that like I know this is a little bit off topic from what we were talking about, but like I really encourage people if you're involved in any kind of research, like write down everything, document everything that's impacting
Mhm.
your family, because there may be a situation where FDA says, you know what, I don't think this drug is effective enough based on what we were looking for. And you might have a situation where you could come in and testify and say, it didn't do this, but it sure did that, and this is life changing for us. Or even, when we talk about the SCN2A community approaching the FDA and saying like this is something you need to know about this community. One of the things that you could share is like this, if we could get a drug or a treatment that could change this aspect of our child's life, it would be life changing for our whole family. I think it's a brilliant way to look at it, Sean. And I think a lot of times we think about like the risk for the whole family, but yeah, there's huge. It's huge for both. Um, just for technical purposes, they may not. There are some research projects where they can't consider anybody else other than the participant, but for realistic real life situations, I think it's really incredible to think about the whole family unit, especially when we talk about sleep. Like that's no joke. And that directly benefits a child or harms a child if the parents aren't sleeping, right? You could
Mhm.
crash your car, right? Like those are real. That's real life, and that's what FDA needs to hear. So I'm so glad you brought that up. Any other thoughts about benefits, or ready to move on to risks? All right. So risk, and I put risks of intervention or of non-intervention to really highlight, when I say intervention, it could be a clinical intervention or it could be, for the purpose of this conversation, we're talking about research, but it applies to anything. It could be, choosing to put your child on a medication or not, or having a surgery or not. Like, what are the risks of doing the intervention versus what are the risks of not doing the intervention? An example, when Morgan and I were chatting about the different examples, I my career has largely been in public health, and I was a frontline health department worker during COVID, and I was helping to set up the first vaccine clinic on day one. And as frontline public health, I was offered the vaccine 9 a.m. on day one. Actually, honestly, I was offered the vaccine the night before we opened the clinic because we had already set it up, and they're like, "Yeah, do you want it now?" Um, and I'm risk averse, and I said, "No, I'm good. I'm gonna wait. I want the vaccine, but I need a little more data before I can say yes. Not a lot. I need a little." And so I mentally said, "I'm like, how many people need to get this vaccine before I feel comfortable knowing the full range of side effects? Like, I'm not talking about long term, whatever. I'm like, I just need to know, like, I get this injection and like I grow blue hair. I don't know. I need to know." And so in my head, I said, I need a million. I'm like, I want to know about the 1 in a million risk. I want to know everything. I need a million people to get that vaccine before I get it. By day three, a million people had already had it. So I got it on day three. I'm like, all right, I'm cool now. I got it. I'm good. But because at that point, I was comparing the potential risk of the vaccine to the known risk of getting COVID, which was a very high risk for me because I was working frontline public health. So I was like, I knew at that point comparing the risk of intervention versus the risk of non-intervention, it made sense. But I still needed a little more data. I wasn't first in line. I was, 100th in line. I was a millionth in line. I don't know. So thinking about looking at it from both perspectives, it can really help you
Mhm.
to make those decisions. So thinking about risk, like what harm or negative outcome might there be from participating in this research? The harm could be just time, money, resources. You're already stretched super thin. You don't have time for a clinical trial. That's a harm, if you will. It's a con or a negative. Um, could be the side effects for the medication or the intervention, the clinical trial. Sometimes they're serious. Like we're talking about some of the things that Morgan has in her pipeline. Like they're no joke, right? You're talking about like gene therapies or gene editing. Like those have some high risk, high reward if they work, but they're potential for some very serious or life-threatening risks. So it's something to consider. Um, what harm or negative outcome might come if you didn't participate in the research? Say, like, I'm not interested in trying these experimental treatments. They're too risky for me. I'm just going to let nature take its course. Well, in some cases, that's not particularly risky at all. In some cases, that could be life-threatening if you have a life-threatening condition, right? So just considering both options, what are your choices? And is the risk of trying the experimental new treatment lower than the risk of the likely outcome if not treated? Those are horrible decisions to have to make, right? Like nobody wants to be in a position, but many people in rare disease are in that situation of having to try to guess what would happen if they didn't intervene and can take bigger risks um, on clinical trials because they know what would happen if they didn't, or they can guess what would happen based on other people from who have participated and shared their knowledge from in natural history studies and clinical research.
Mm.
Um, and then this is a really big one that we talk about in, especially with the gene therapies or the ASOs. If you participate in this particular hypothetical research situation, is there a risk that it will reduce or eliminate your options for future opportunities? So, for example, I'll let Morgan jump in on some of these, but
Yeah, if you just want to go to the next slide,
yeah,
it kind of helps to list them
yeah,
out.
for sure.
Yeah, so I guess I'll talk about closing the door on future options. So, as you know, the previous town hall, we talked about 6 different drug modalities. And when you really talk about gene therapy, when you discuss gene editing, this is like CRISPR, TALEN, ZNF treatments. These are really like one in a lifetime injections that change the makeup of the DNA in your child to either produce a gain of a function or a loss. And Karen, who is not here with us tonight, talked more about that at the previous town hall. But if you receive an injection of CRISPR therapy, let's say down the line, because right now everything in the pipeline is still preclinical, that may inhibit your chances of obtaining a CRISPR injection in the future because you had received this gene editing injection, 5 years prior. So that's just something to consider. And again, we can go through the pipeline at the end, but that is like one risk to just be aware of, is particular when you're considering participating in an interventional trial that has a gene editing modality component to it. Other risks that really come with participating in an interventional trial itself is the side effects. If your child is given active drug or placebo, do they have an increase in nausea or GERD or GI dysmotility, any symptoms that could make your child's current condition worse or just make the quality of life worse? Safety risks as well that Melody touched on. Depending on the drug modality, this can kind of range in a spectrum. If it is a CRISPR injection, if this therapy doesn't work, what could that cause for my child? These are, again, really important things to discuss when you're having that informed consent discussion and really trying to understand the goals of the research study itself before you decide that you want to participate or you want your child to participate in it. Another is receipt of placebo. We've talked about this a lot, but most typical trials that are working on improving a symptomology, let's say reduction in seizures, they are a double-blind, placebo-controlled trial. That's how it's structured. So half the participants are randomized to obtain active drug, half the participants are randomized to obtain placebo, and the randomization ratios change depending on the drug of interest. But when you enroll in the trial, this interventional trial, your child might receive placebo, which is just a sugar pill, not active drug. And then lastly, to kind of come full circle from when I was talking about benefits, there is a potential for negligible therapeutic effects. So if you decide to participate in an interventional trial for your child, there might be nothing that changes. And you might not know if your child is receiving active drug or placebo. So it is kind of this waiting game. And you might not actually know if there's going to be a benefit therapeutic effect or not. And so that's why these open label extensions and expanded access programs are so important and something that you need to consider during the informed consent conversation, because those two programs, you will know that your child is receiving active drug. And then from there, based off the results of the trial, you can determine if it did provide a therapeutic benefit for your child or not. And then lastly, the washout period. This is kind of more of a timeline thing. The washout period is essentially if you decide to exit a study, no matter if you decide to exit the study early or once it's finished, because any participation in an interventional trial is voluntary and you can exit at any time. This is a period, it depends on the trial itself, but this is where your child will wash out and not take the medication. They will kind of wean off of it, and the technicalities will be described when you exit the study itself. But during this washout period, typically you can't try any new drugs or change anything basically in the care management, because you need to make sure that that drug that your child was on during the trial is completely washed out and weaned out of their system, essentially.
And especially with that, that may limit your opportunities for enrolling at all. Like if there's a, if you wanted to enroll in an additional clinical trial and the enrollment window is 2 months long and your kid's in the washout period during
Mhm.
that enrollment period, then you miss the chance to be in that study if you enrolled in the first one. So just sort of asking the questions and really
Yeah.
staying abreast of what the pipeline looks like and talking to Morgan or Sean or Karen about like what's out there and, is it, should I consider this one or should I hold out for something? And that's a decision that you have to make with your clinician and with your research team. But the Families SCN2A Foundation research team can also help guide you for information to be part of your informed consent conversation. All right.
Great.
Any thoughts or questions about risk?
Nothing in the chat.
Okay.
Um,
Okay, so that's B and R in brain. A in brain is alternatives. So what are your other choices or options, if anything? So going back, another plug for the pipeline. Morgan's done an amazing job really documenting what's out there and giving a good sense of what to be hopeful for. But also maybe you have some clinical choices. Maybe you could just go to your doctor and there's already an FDA approved treatment, or maybe there's an off-label treatment that could still be prescribed, or maybe there's an alternative or complementary medicine that you might consider. Maybe you have some alternatives or it's something else that you could try. Um, and as we talked about before, your risk tolerance for a particular intervention may change quite a bit depending on whether you have other options or if this participating in this particular research opportunity is really your only choice, either your only choice for access or your only choice for treatment at all of whatever symptoms or condition that you're trying to address. Um, so some examples of alternatives.
Yeah, that goes right
Uh,
into the next slide.
yeah,
So, alternatives, just because you might hear buzz of a new trial that's currently enrolling for SCN2A patients with the gain of function mutation, that doesn't mean you have to choose and really make that your primary goal of something you want to get involved in. Maybe there are other standard clinical interventions, one of the other 20 some anti-seizure medicines that potentially you've researched yourself, found research on, and you want to have that conversation with your doctor about adding that to your child's care management plan. Um, that's just an example. Standard clinical interventions, things that are already improved, working with your doctor on your child's care management. Other current clinical trials. So, like I said, I'm working on some work to characterize current trial opportunities that are out there that are beyond seizure control and ASD related symptoms. So, like Dan had mentioned, decreasing nausea. Like, is there a drug that potentially your child could now start taking to try and help manage that symptom? That's an alternative than just participating in a interventional research study. And then future clinical trials, like I mentioned, a lot of our gene editing trials are currently in the preclinical phase where they're getting validated with animal models and cell culture lines. Who's to say, like, we have some estimated timelines on how long that's going to take, but there is stuff coming down the pipeline that eventually will be able to be tested and tried in humans. So we're working on keeping that as up to date as it goes. And it's just really amazing that there is so much out there already for the community in 2025.
super hopeful. All right. This one is my favorite, and this is hard. Some of my scientist friends don't love this one as much as I do, but I really give value to intuition, especially parental intuition. There's sometimes you just know, right? You got to trust your gut. What does your instinct tell you, or your gut feeling? Do you think that this is the right opportunity? Do you think it's not the right opportunity? You know your children best. You know them better than their doctors. You know them better than any researchers. You know them. You know yourself. You know your family. Does this feel right? And that's a consideration. And it's okay for you to trust that instinct, even if you're data driven. It's okay if that voice in your head is guiding you one way or another. And I think that probably goes right back to those finance examples, right? Like, do you ever just get a gut feeling on a stock or on a, dude, take a chance on this little startup? Like, I feel like this, it doesn't look good on paper, but man, they've got gusto. Like, I really just
Just
want to
speaking
throw
our
my
love
money at them.
language. Melody, just keep speaking our love language. Sean and I are so happy. This is great.
I love it. I love it. Um, but I just really feel like it's okay to trust it. And it's also okay if other people don't understand why you feel the way you do. You don't have to justify your
Yeah.
feelings. You don't have to second guess yourself. Like, I feel like as a mother, I very rarely second guess my gut when I follow it, but I have second guessed when I didn't follow my gut and I did something anyway. And I was like, why did I do that? I knew better. Why did I do that? I knew that didn't feel right and I did it anyway because somebody talked me into it or because I gaslit myself or whatever. Like, you just trust yourself. I think it's a really important part of the brain algorithm. Or I keep saying algorithm. It's an
Acronym.
acronym. Thank you. Why can I not get my A words today? Sorry. Okay. But N, numbers. Okay. So this, I'm talking to my finance guys again. Here we go. Got data. Got any data? Got any stats? Got any, did you got any sheets or anything? Show me an Excel spreadsheet with some numbers. I want to see what we're
Mhm.
talking about here. Have people already enrolled in this study before you? Do you have some information on this? Is this a phase 3 trial? You have phase 1 and 2 data. Do you have any safety or tolerability? Has this been used in another indication, right? Has there been a treatment, maybe not for SCN2A, but maybe something similar enough that you can start looking at other groups and getting some data to make an analysis for those who are data driven. Um, I don't know. Morgan, do you want to add any more on the numbers?
Yeah, I was actually going to say, like, an important question that you could bring up to the research context if you decide you want to participate in an interventional study is related to numbers. How will I be personally informed on the results of this trial or the results of how this drug did once and then I have completed the trial with the drug developer? I think it's really important to bring up, will you, as the participant, or your child as the participant, be personally informed on the results of the interventional trial? And I think this is a good point you can hone in on when you're having those conversations with your provider and then the research team itself, if there will be information that will go out to you on the results specifically.
Awesome. And I just want to also point out that you can change N. It doesn't have to be numbers, especially if you're not super analytical, if this doesn't appeal to you. N can also stand for no or not now. It's okay to say no. It's okay to say, I don't want to participate in this clinical trial. And it's also okay to defer it. My only thought with deferring is to make sure that you're not closing that window. Like, how much time do you have to make a decision? That's part of the informed consent conversation. Say, like, I'm not ready to say yes to this right now, but if I called you back in a week after I had some time to think about it, or a month, or a year,
Mhm.
will this opportunity still be available to me? So, just make sure that you don't close the door accidentally, but it is okay to say, this doesn't feel right now, but I'm not saying no forever. John,
And
you got your hand up?
yeah.
Just a quick one on numbers. I think often we get data from clinical trials and we use that a little bit like our Bible of thinking about, how good or how safe the drug is. But clinical trials are really designed to answer a question. We've talked about that a lot for like the integrity of the trials, but it's important for like this context too, in that, when you're looking at the data and seeing like if you're using that as, your Bible to make decisions, like the questions you should be asking, like your clinician is like, you know, how similar is my child to the patients that enrolled in this trial? Like, were they the same age range? Are they a similar variance? Like help frame your decision making with the data with kind of how similar or how different that your child is for the data. I think that, so sometimes you could really be talking apples to oranges, or if it's really similar, then you can weigh that data like with higher degree of value because like, wow, like these are really similar to my child because of XYZ. I have more confidence in the data than I would in another context.
That's brilliant. I love that. You're
Great.
also making it just a little bit of a plug for our future FDA engagement. I think that's one of the real important things that the foundation is going to be doing is sharing with the FDA that, a child with an SCN2A variant is not the same as another child, is not the same as another child, that there's different phenotypes and they present differently, and to make sure that the FDA has a really clear understanding of what it looks like and how children or individuals might vary, and to make sure that they wind up in the right trials and they're evaluated the correct way. That's a super critical point, and it's really important for your own personal risk tolerance and analysis too for making decisions.
Mhm.
Thanks, Sean. Anybody else want to jump in on numbers, data, thoughts? Okay. How are we doing for time?
About like 7 minutes for
Yay, perfect. We're right on
questions. Yeah,
track.
yeah.
That's amazing. Okay. Um, so there are a bazillion questions that you can ask, and we have this right up on our website. You can scan this QR code, or you can just go to the research website and find it in the How to Participate in Research tabs as you go down. But these are questions that are actually from OHRP, which is a U.S. government federal agency that helps. It's the Office of Human Research Protection out of NIH and I think or HHS, one of them. Anyway, excuse me, but it's these are a list of research questions, and so really thinking about questions to ask about the research, questions to ask about benefits and risks, privacy and financial and other considerations. And so please take advantage of this. And then we'll also be putting up additional questions on the website as we've had conversations with families of maybe the top 10 questions to ask or top 5 that seem to come up in the SCN2A community. So Morgan, was there any in here that you particularly wanted to highlight or anybody? I know there's a lot of trying to make them bigger.
I think,
Yeah,
yeah.
you can see
Well,
there's a bunch of them.
yeah, you're good. Mostly about privacy, and I think this is a discussion we could totally expand upon in the September town hall if we really hone in on getting research ready, but essentially how can I ensure that my child's identity will be protected and what will that privacy process look like? To me, I think that's a really big one, especially considering participation in a clinical trial.
Yep.
So that would be something that I would ask at the forefront of my mind. But again, I think this is a topic that we plan to hopefully expand upon in the September town hall as
Yeah,
we discuss getting research ready. And we're going to talk about privacy as well.
that sounds great. I'm excited for that one. Just on this list of questions, looking at some of them are really basic and they're already going to be given to you as part of the study protocol or part of the informed consent documents. And again, the document is just highlighting information and getting your legal signature for participation, but it's not enough. You have to have the conversation as well for it to be truly informed consent. But questions that, real like logistic questions like how long does this study last? Like, what am I committing to? You want me to go to Cleveland every month for a year? Like, that's a big commitment. You want me to go to
Mhm.
Cleveland once? Okay. Who's paying for it? Okay. Like these are questions like you want to know, or you have to take a day off from work. And going back to Sean's point, like me taking a day off of work impacts my family financially. Oh, and you want me to go to Cleveland? Okay, well, I got to take my other kids too. And now I'm pulling everybody out of school. Like this is a production,
Mhm.
right? Like how are you supporting us? How is the clinical trial? Are you making our travel arrangements? So you get a hotel for
Right.
us? Like what's happening here?
Are there accommodations from you, the drug developer, any
Yep.
financial reimbursement programs available for me if I decide to participate? Hmm.
Exactly. So some of the questions we were talking about like, the benefits and the risks to the individual, but like a lot of the informed consent process is just the logistics of like what's happening? What do you want? What are you asking me to do? Like, or, all right, tell me about this, intrathecal injection. Is there anesthesia? Is there hospitalization? What happens if in the process of the clinical trial, there's some sort of complication. Where does my child receive medical care? What if the clinical trial was not at our home medical center. What you start asking those questions
Mhm.
about, like how would we get home? How do we manage all this? What would happen if we had to spend an extra night or two or three? There's all those like logistic questions. That's part of the informed consent process too, to make sure that you're really willing to adhere to that. Because remember, going back to your responsibilities, if you sign up for this trial, they really need you to stick to the protocol. Otherwise, the data may not be valid, and it can really interfere with the analysis of whether or not the treatment is actually effective. So, um, questions like that, financial considerations, as Morgan had mentioned, like is there compensation? They're not allowed to pay you for research, but you took time out of your day to get there. They can potentially buy you lunch or give you a little bit of financial reimbursement for your time. They're not allowed to, have undue influence of offering you so much money or so much compensation that you're like, yeah, I'm willing to sacrifice my kid's safety here because I really want that
Not incentive.
$1,000 trip to
Yeah.
Disney, whatever. Like they're not allowed to be coercive with their compensation, but they are allowed to, depending on the IRB protocol, they are reviewed protocol, they are allowed to offer you some consideration. So things like that, asking the questions about the logistics, asking the questions about what it really means to be in the study and what
Mhm.
the whole, the risk benefit uh, alternatives, intuition, numbers, and logistics. What does that mean? And that's part of the informed consent process. So that's what we've got here. We've got some emails that you guys can to reach out to us, please, if you have more questions, if you want to make suggestions for future town halls, please reach out to us, to Karen or Morgan or myself. And then, as always, please talk to your providers for any questions or any thoughts, and reach out to our team, see if we can help. And then more resources, because you learned so much, you just need more. So these are up on the website, but also Morgan was kind enough to pull up QR codes for some external sites that you can learn more about, including from the Courageous Parents Network, from ASGCT, and which is the American Society of Gene and Cell Therapy, and from NORD, which is our National Organization for Rare Disorders, umbrella organization for rare diseases. And that's it. Coming soon. We've got just a little teaser, some get research ready topics. And that is it for us with 1 minute to spare. We did it.
We got time for a few questions if
We
there's anything
do.
pressing for anybody. Thank you so much for joining.
Yay. Sean, you got your hand up?
Uh, on the coercion one,
Ah,
it kind of sounds a little bit like, why did this make sense? I mean, if we could be paid more money for participating, why isn't that a bad thing? Maybe can you talk about why those are in place and why that is coercion?
yeah. And this is one of the things we had talked before the meeting started. We had talked a little bit about how ethical considerations in anything, or especially in research, it's a moving target. It's not like the law where it's set. It's the human appetite for certain things will vary, and this is one strong example of participant compensation. When I first started studying bioethics, participants could barely be compensated for anything. Like, here's your lunch voucher at the hospital cafeteria, and some bus fare. Like, that's it. That's all you get. And it's evolving to be more like, hey, people did take the day off from work. They did have to get daycare for their other kids, or babysitters or whatever. They did have to travel. There's more compensation. But what you don't want is for the enticement of the participation in the research to influence your decision. If it's part of your informed consent conversation and you're like, well, I've got the risks and the benefits, but oh man, I really want this benefit. I really want an all expense paid trip to San Diego for a month to participate in this trial. Like, that could influence your decision. And then is it really voluntary? And then that gets infinitely more complicated when we're talking about kids, right? Like, I can choose myself as, an adult with capacity. I can decide I'm willing to take that risk. I want to go to San Diego, right? Like, I want to do that. Making that decision for my child, much more complicated. And so every research study that you'd be asked to participate in, especially clinical trials, will have already been reviewed by what's called an IRB, or an institutional review board, also known as an ethical review board. They will have already reviewed the protocol, including the compensation, and they will have already kind of discussed whether or not they think that the compensation is coercive or undue influence. And so you can rest assured that when they're offering it to you, it's already been reviewed, but they're not infallible. And I think, a study protocol could go to 5 different IRBs and get 5 different decisions, because they're humans, and different people have, again, different thoughts about compensation. But at the end of the day, you just want to make sure that the amount of money or the benefits that are being offered, the perks that are being offered for clinical trial participation do not influence your decision, especially when it comes to risk. That's Again, I could talk for an hour about that, but I think that's the two
Yeah,
second
thank
version.
you.
Did that answer your question?
No, it was perfect. Thank you so much.
Thanks.
You guys are fantastic. I could listen to you talk for 10 hours, but I just have to say, I mean, knowledge is power, and I
Yeah.
always feel so much more knowledge. So thank you for all that you guys do. We're so grateful for these. I mean, it's just great. Great job.
Oh, thanks, Dan. You're
Thank
making
you.
my day.
Yeah, same. Any other comments, questions from anyone else in the crowd
Or
or the
thoughts for
Zoom?
future discussion. We're
Yeah,
we're always evolving and trying to figure out, how much to share.
and what your needs are or anything else, and maybe it wasn't clear.
No, fantastic.
Okay.
Well, everybody, thank you so much for your time and your thoughts and your questions and your, you know, Dan especially, like I really, you were smiling and nodding.